Sarasota County has its first 2 cases of COVID-19. The health department says one is a 50-year-old man from New York who is seeking treatment in Broward County. The other is a 70-year-old man from Massachusetts who's been isolated at Sarasota Memorial. That is where 10 News reporter Eric Glasser is tonight. And Eric, what do we know about this patient?
Katie, well, as you mentioned, he's 70 years old. He's from Massachusetts. He is a part-time seasonal resident here in the Sarasota area. What they're not clear about yet is what his travel history recently has been, and they're still trying to determine exactly who it is that he's been in contact with in recent days and weeks so that they can also check on their health conditions as well as this virus and concerns over it continue to spread.
I don't know. I sure hope that they have it under control.
Marissa Rose is 7 months pregnant and about to visit her doctor at Sarasota Memorial. The hospital just confirming it's treating its first case of coronavirus.
Well, now I'm kind of nervous. I don't know. I might reschedule, actually.
The hospital is working hard to calm those fears while they treat this 70-year-old man from Massachusetts who lives here part-time.
We've identified 16 staff members that we've asked to go into self-quarantine at this point while we evaluate what exposures they may or may not have had.
Sarasota Memorial says it's still working to identify anyone outside the hospital who their patient might have come in contact with.
We're still combing through all the data to make sure we haven't missed anybody.
Hospital workers were also still clearly frustrated with the low number of tests available and the pace at which they're being processed. They say private companies like Quest and LabCorp now ramping up should help.
Testing remains focused primarily on hospitalized patients and those at higher risk.
As the virus has spread, Sarasota Memorial says it's been gearing up for more patients, but some who live and work nearby aren't completely confident local medical centers can handle it.
No, I'm not confident at all. Yeah, I mean, I don't know. I hope they do have it under control and hope they, keep it isolated.
It can still be easily overwhelmed at a time like this. So if people don't need to be in the hospital and don't require medical care, then their best move is to stay home and isolate.
I'm not worried about me, but just Aubrey. She'll be here in a couple months. Hopefully it won't affect her.
Sarasota Memorial tells me those 16 staffers who are in self-isolation at this point, they are all doing okay, not showing any symptoms, so that's good news. And the patient himself is also said to be doing well.